Welcome to the deep dive. Today we're tackling a really influential piece of research in vascular surgery. It's called the VANISH II study.
That's right. It took a very close look at a modern way to treat varicose veins using something called Polydacanal endovenous microfoam, or PE for short.
Right, PEM. And we've got the summary here from that 50 landmark papers book that vascular surgeons should know.
Yep.
And our goal today is, well, pretty simple.
Yeah,
We want to pull out the key insights so you can really get a handle on this treatment and, why it matters.
exactly. We're going to dig into the study, what it tells us about treating varicose veins that come from problems, specifically at the saphenofemoral junction.
That's the SFJ, right, in the groin.
Correct. That critical spot where the big superficial vein, the great saphenous vein, connects to the deep femoral vein.
Okay. And when that junction isn't working properly, that's where the trouble starts.
Precisely. It can lead to blood flowing backward. Reflux is the technical term, and that's often the root cause of those visible, sometimes painful varicose veins you see in the legs.
Okay, let's unpack that a bit more. This SFJ incompetence, what's actually going wrong there, and how does it, lead to the veins and the symptoms?
Well, think about veins having one-way valves, right? They're supposed to keep blood moving up towards the heart against gravity.
Makes sense.
When the SFJ is incompetent, those valves near the junction fail, so blood flows backwards down the leg instead of up. That's the reflex.
Oh, okay.
And this increases pressure, blood pools in those surface veins, and that's what makes them bulge out, become varicose. And it causes symptoms like pain, swelling, that heavy feeling, even skin changes over time.
Right, so the VANISH II study zeroed in on this. Could this microfoam, PEM, actually fix this SFJ incompetence safely and effectively?
That was the core question.
And they tested two different strengths of the foam.
Exactly. They wanted to see if this specific commercially made foam at 0.5% and 1.0% concentrations worked better than a placebo, for both the symptoms and how the veins looked.
Yeah. And how did they set up the study to find that out? What was the structure?
It was very well put together, randomized, for starters.
Meaning patients were assigned randomly to groups.
Correct. By chance, they got either one of the PEM treatments or the placebo. It was also blinded.
So nobody knew who got what, patients or doctors?
Neither. Double-blind and multicenter, done at several different places, which makes the results more robust.
Okay.
And it compared the two PEM strengths against the placebo all at the same time. Now, the main paper we're looking at focuses on the first 8 weeks.
But there was longer follow-up later.
Yes. There's another publication with 1-year results, but the 8-week data was key for the initial findings.
And who are the people in the study? What kind of patients?
They enrolled adults aged 18 to 75. The main thing was they had to have proven reflux at the SFJ.
That backward flow you mentioned.
Right, lasting more than half a second on ultrasound. And it had to be coming from the great saphenous vein itself or a major accessory vein nearby.
Okay. Did they all have severe varicose veins?
No, it was a mix. They used the CEAP classification, classes 2 through 6. So roughly a third, maybe 32%, were C2, just visible veins.
Okay.
About 40% were C3, veins plus swelling. Around 23% were C4, meaning they had skin changes.
Like discoloration.
Exactly. And then a smaller group, about 5%, were C5 or C6, which means they had healed or active ulcers. So a pretty broad range of severity.
And how many people participated?
They randomized 235 patients initially, and 230 made it through that first 8-week follow-up period. So good retention.
Okay, a decent-sized group with different levels of vein problems. How were they monitored after getting the treatment?
They had regular follow-ups, including duplex ultrasound scans.
To actually see inside the veins?
Yes, to visualize the blood flow in the vein itself. But the main thing they measured, the primary endpoint, was patient-reported symptoms.
Do they track that?
Using a specific daily diary, the VV-SUM-Q score, patients basically rated their symptoms each day.
Makes sense. What else?
They also looked at appearance. Did the veins look better? Both from the patient's point of view and assessed by independent doctors looking at photos.
Okay, patient and physician assessment.
Right. Using specific scales, IPRV3 and PAV3. And then there were other things, like the ultrasound response itself, a clinical severity score called VCSS, and quality of life questionnaires.
Quite comprehensive. Were there people who couldn't join this study? Any specific exclusion?
Oh, yes. Standard stuff mostly. Anyone with a history of DVT or pulmonary embolism was out.
Blood clots, okay.
Right. Also, people who couldn't wear compression stockings afterwards, or if the problem was in the small saphenous vein, not the great one. Deep vein reflux was another exclusion.
What else?
Limited mobility, recent major surgery, pregnancy, or recent hospitalization. Basically, things that could complicate the treatment or the results.
Got it. And the treatment itself, what did it involve? How much foam did they get?
The procedure involved injecting the foam. The maximum allowed was 15 milliliters in one session.
Yeah.
And that could be the 0.5% PEM, the 1.0% PEM, or, interestingly, a very low dose, 0.125% PEM, which acted as a sort of active control.
An active control, not just a plain placebo.
They had both. There was the 0.125% PEM group and a true placebo group, which looked like the foam but had no active drug in it.
Ah, okay. So 4 groups in total, effectively.
Effectively, yes, comparing the two main doses against those controls.
All right. We've covered the problem, the goal, the setup, the patients. Now, the really important bit, what did they find? What were the main results?
Well, the headline finding was about symptoms. Both the 0.5% and the 1.0% PEM groups showed significantly better symptom improvement compared to the placebo.
How much better?
A lot better. The PEM groups reported about a 64% reduction in their symptoms on that VV-SYMQ score.
Wow, 64% compared to placebo.
Compared to only 22% reduction in the placebo group. And that difference was highly statistically significant.
That sounds like a difference people would really feel.
Absolutely. You know, less pain, less heaviness, maybe being able to stand or walk longer without discomfort. It suggests a real impact on daily life.
That's very positive. What about the appearance? Did the veins look better too?
Yes, they found significant improvements in appearance as well, again, in both PEM groups. This was based on both the patient's own ratings and the scores from those independent doctors looking at the photos.
Okay, so symptoms better, looks better. What did the ultrasound show? Did the treatment actually, close off the problem vein?
It often did. They saw high rates of eliminating that SFJ reflex or completely occluding, blocking off the great saphenous vein in the PEM groups.
That's high.
It was about 83% for the 0.5% group and 86% for the 1.0% group at that 8-week mark. So good anatomical success, too.
Okay, so effective on multiple fronts.
Right.
Now, the flip side, safety. Were there any major red flags?
Well, the really serious stuff, thankfully, no. The study reported no cerebrovascular events like strokes or TIAs and no cases of anaphylactic shock, that's severe allergic reaction.
That's crucial.
Very important. However, they did see more thrombotic adverse events issues related to blood clots in the groups that got the active foam.
Okay, how much more?
It was around 10.4% in the combined PEM groups, compared to about 3.9% in the placebo group.
So a higher rate, but what kind of events were they? Serious clots?
Mostly not. The study stated that about 95% of these thrombotic events were considered mild or moderate.
Okay, mild or moderate, like what specifically?
The most common things were stuff like retained coagulum.
Which is like little clot trapped in the treated vein.
Exactly, kind of like an internal bruise in the vein. Also, leg pain and superficial thrombophlebitis.
Inflammation of a surface vein.
Right. And the researchers felt most of these were treatment-related and generally resolved without causing long-term problems.
Were there any deeper clots, though? DVTs?
Yes, they did report some. There were 9 patients, about 3.9% overall, where thrombus, or clot, extended into the common femoral vein, the main deep vein in the groin.
Is that serious?
It's definitely something you watch closely. But importantly, none of these were occlusive, meaning they didn't fully block the vein. They also reported proximal DVT closer to the body in 2.6% of patients and distal DVT further down the leg in 3%. And 2 patients had clots in their calf muscle veins, the gastrocnemius veins.
Okay, so some DVT did occur. How are those cases managed?
It was about a 50-50 split. Half the patients with these clots got anticoagulation blood thinners.
And the other half?
They were managed more conservatively with things like anti-inflammatories, compression, and just careful monitoring.
Did one approach work better?
Interestingly, the study reported no significant difference in outcomes between the 2 management groups. All the patients were followed until the clots either resolved or stabilized.
How long did that take?
The median time was about 29 days, and critically, they didn't detect any pulmonary emboli clots traveling to the lungs in any patient in the study.
That's reassuring. So quite a bit of detail on the safety side. What's the big picture takeaway from VANISH II? Why is it considered a landmark paper?
Well, it was really pivotal. The results from VANISH II were a major reason why the FDA approved this specific commercially made foam, which is marketed as Varicose.
Ah, so it directly led to the approval of a product.
Yes.
No.
It essentially provided the high-level evidence needed to show that this standardized formulation had a, reasonably good safety profile for treating these larger superficial veins. That was a big deal.
You keep mentioning commercially manufactured or standardized. How is that different from what doctors might have done before?
Good question. So, before products like Varithena, if doctors wanted to use foam for larger veins, they often had to make it themselves.
Make it themselves.
Usually by mixing the liquid sclerosant, like Polydacanal, with air, typically room air using syringes and a stopcock. It's often called physician-compounded foam, or PCF.
Okay.
And while it was used off-label for bigger veins, the liquid itself was mainly approved for tiny spider veins. There were some concerns.
Like what?
Well, consistency, for one. The bubble size could vary a lot depending on how you mixed it, and because you're using room air, it has a high nitrogen content.
Why does nitrogen matter?
Nitrogen isn't absorbed as quickly in the bloodstream as, say, oxygen or carbon dioxide. There were some anecdotal reports, case studies linking PCF use to things like transient visual disturbances or other neurological symptoms, especially in people who might have a PFO.
A patent form an oval, a small hole between heart chambers.
Exactly, which is actually pretty common. The idea was maybe larger, less stable, nitrogen-rich bubbles could pass through a PFO and cause temporary issues.
Okay, so consistency and nitrogen content were potential issues with the homemade foam. How is Varithena different?
It's made in a controlled manufacturing process. It's a 1% Polydacanal foam, but the gas used isn't room air. It's a specific mix of oxygen and carbon dioxide, 65% O2, 35% CO2.
And low nitrogen.
Very low, less
Yep.
than 0.8%. The idea is that these more uniform, smaller bubbles with absorbable gases get taken up by the blood much faster.
Which could mean less risk of them traveling elsewhere in the body.
Potentially, yes. A lower risk of clinically significant systemic embolization. There was another study that supported this idea, looking at bubble persistence.
Right. So a more predictable product. Beyond safety, what else did VANISH II demonstrate about this type of treatment?
It really showcased the effectiveness of a non-thermal, non-tumescent method.
Okay. What do those terms mean?
Non-thermal means it doesn't use heat, unlike laser or radiofrequency ablation, which basically cook the vein shut.
Got it. And non-tumescent.
Tumescent anesthesia is that large volume of dilute local anesthetic mixed with saline and bicarbonate that gets injected all around the vein before thermal ablation. It numbs the area, protects surrounding tissue from heat, and collapses the vein.
Okay. So PM doesn't need that.
Correct. Chemical ablation with PEM avoids that whole step of injecting large volumes of tumescent fluid. So potentially it's a bit less invasive in that sense, maybe less procedural discomfort for the patient.
That sounds like an advantage. Are there any potential downsides to PM compared to the heat-based methods?
Well, one thing that's been discussed is maybe a bit more technical variability. With thermal ablation, you place a catheter right in the main vein, the axial vein, and deliver the energy very precisely along its length.
Very targeted.
Exactly. With P, the foam is injected, and it can flow not just along the main vein, but potentially into tributaries, perforator veins. It's maybe less directly controlled where it all goes.
Oh, I see.
And this has led to a theoretical concern. Could this less directed approach, exposing more of the venous system surface area to the sclerosant, possibly lead to a slightly higher risk of DVT?
Right, the clot risk again. Did VANISH II shed light on that comparison? Did it show a higher DVT rate than typical thermal studies?
It's tricky to compare directly across different studies, but yes, the rate of thrombotic events, including that common femoral vein extension reported in VANISH II, was higher than what's seen in some large series of thermal ablation.
You mentioned the monitoring was really strict in VANISH II.
Extremely strict. They did very detailed ultrasound surveillance after the procedure. It's possible they simply detected more of these events, even minor ones, than might be caught in routine practice or other studies with less rigorous follow-up.
So it raises the question, but doesn't definitively answer if the actual risk is higher.
Exactly. We probably need more head-to-head randomized trials directly comparing modern PM with modern thermal ablation, using the same strict follow-up protocols for both to really know for sure. It remains a bit of an open question.
Okay. It's interesting how these findings sort of slot into the bigger picture of treating veins.
Absolutely. VANISH II was definitely a catalyst. It really boosted interest and further research into these non-thermal, non-tumescent options. For vascular specialists, understanding this study is crucial for knowing the full range of tools available alongside the established thermal techniques.
So let's try and wrap this up. If you had to give the main takeaway from VANISH II for someone wanting to understand modern vein treatment, what would it be?
I'd say the key takeaway is that this commercially prepared Polydacanal microfoam, Varithena, demonstrated itself in a large, well-conducted trial to be a pretty effective and reasonably safe, minimally invasive option for people with symptomatic varicose veins caused by SFJ incompetence.
Right. It showed clear benefits for symptoms and appearance.
Yes, strong evidence for that. It offers a viable alternative, particularly one that avoids heat and tumescent anesthesia.
And it really highlights how treatment has evolved, moving towards these more standardized, perhaps safer foam formulations compared to the older compounded methods.
Precisely. It marks a step in the evolution of sclerotherapy for larger veins. But, as we discussed, ongoing research is still important to fully clarify its place, especially comparing long-term outcomes and those finer points on safety versus established methods like thermal ablation.
Definitely. So considering these advancements like standardized foam and non-thermal approaches,
Yeah.
it really makes you wonder, what's next? What future innovations might make varicose vein treatment even more refined or personalized down the road?
That's the exciting question, isn't it?
It certainly is. Thanks for taking this deep dive into VANISH II with us today. It's given us, and hopefully you, a lot of valuable insight.